Hi everyone, welcome to sessions 56. And the topic for discussion is nursing from old to new. Let's take a look at what we're about to discuss. Looking at nursing from old, antebellum nursing, hemodynamic monitoring, EKG reading, code blue mechanical ventilation, hemodynamic nursing, PACU, OR nursing, and CRNA. So there's quite a lot to discuss. And by the way, if you have trouble with EKG reading, you may just want to look at sessions 16, 17, and 18. They're all very helpful. So let's get started. Now, nursing from old to new. Many young people, both men and women, choose nursing as a career. It is a world-renowned profession. It is a wonderful profession in which to learn and grow in knowledge. However, was it always that way? Let us take a look at nursing of old. I know today you hear many people wanting to go into nursing, but I can assure you of one thing, it was not always that glamorous. There is a lot to be said for the changes that it had to go through to get this way. So let's start with what is called antebellum nursing. This era encompasses before the Civil War, which you know. I am about an overview of antebellum nursing. The antebellum period refers to that period before the Civil War in the USA. And the Civil War occurred during 1861 through 1865. During the antebellum era, the sick was cared for in the home. Nursing was hands-on and there were no university degrees. Caring for the sick was done in the home by family members in the southern United States. Slaves were known to care for the sick. During the Civil War, nursing began to get more recognition. It is suggested, however, that by the latter part of the 19th century, there were only 4 nursing schools in the whole of the United States. By the beginning of the 20th century, however, nursing would start to receive recognition as a middle-class profession in the United States. Well, where is nursing today? Let's take a look. Let's scrutinize the different departments and what goes on. Here we have nursing, some of the things that nurses now do that they didn't before, like in the ICU, hemodynamic monitoring, the pulmonary artery catheter, which is inserted by the doctor. The nurse takes care of monitoring all the waveforms, the CVP pressures you can see here, the pressure in the right atrium, the right ventricle, and the pulmonary artery, which is also, they always do like a wedge pressure with that little balloon they blow up with a small syringe. And of course, you know that nurses can now read EKGs and interpret them. You can see in the left-hand corner there's a patient with ventricular fibrillation, and then there's a ventricular tachycardia. And of course, if you're not familiar, I've suggested that you go to session 16. Here we have the P wave, which signifies the atrial contraction, and the QRS, the ventricular contraction, and the T wave, when the heart has a very brief resting time. These are only some of the advances that you can see that nurses now do. Of course, we take this for granted. Little do we know at one time this was not even a thought that a nurse could get that far. So the nurse does assessment, documentation of the patient complaining of chest pain in the ER, as you can see here, and those are some of her responsibilities also. Here is Mr. H. He's a patient in the ICU. He's in for a cardiac workup. The nurse finds him unresponsive. Naturally, she does an assessment. He's pulseless. He's in ventricular tachycardia. She calls a code, and the code team arrives. This is a joint effort. Again, there is the doctor, and there are nurses who are trained, advanced trained nurses in ACLS, to take care of such patients. There is a code blue in progress. This patient is eventually, they were able to resuscitate him. He had mechanical ventilation. He's now on mechanical ventilation, still in the ICU, and he will need to be dialyzed. Another nurse is going to take care of his dialysis. Now, she may not be an ICU nurse, but she has her own skill in dialysis, hemodialysis. So we've discussed again the nurse who is proficient at something like hemodynamic monitoring, the other nurse an ICU nurse, then you have the nurse who ACLS code blue, and then we have the nurse who is skilled to do hemodialysis. Well, now let's take another look at where do we go from here. This is only one type. What about the other nurses in the other areas? There are nurses who work in the OR, and they are called OR nurses. And then you have those who go beyond that, and they are called CRNA. They're Certified Registered Nursing Anesthetists, and they actually administer anesthesia to patients. Once the patients have had surgery, they go out into an area called the PACU, which is the Post-Anesthesia Care Unit. And another nurse, PACU nurse, will monitor these post-operative patients. So here we can see, when we go through the spectrum, there's just a high level of skill, all in its different areas that nurses are very proficient at. I think, in my estimation, I've been a nurse for over 3 decades. It's a wonderful profession. It's just great to do a good job with whatever you do, wherever area you work in, to do the best job that you can do, because it is a highly skilled profession and it has come a long way from old to new. So hope you enjoyed learning. Have a great evening.